We continue to see this growing spread of the variant strains. Again, first identified in the UK and South Africa. The Brazilian strain not in Ontario yet, but there are dozens of cases of the UK and South African variants identified yesterday in Alberta and BC. Ontario spoke publicly of the first confirmed case of the South African strain. So that's the beginning point for our conversation with Dr. Isaac Bogoch, who's an infectious disease specialist at Toronto General Hospital, also a member of Ontario's COVID-19 vaccination task force. Dr. Bogoch, good morning. Good to have you here on such a timely conversation to talk variants all through our conversation, all right?
Sure thing.
We're on a sole focus today. Variants, with all of the things that I was just mentioning, into more and more of the provinces, Ontario with the South African strain now. What is the latest science that's catching your eye to help us understand what we're dealing with here when we talk about these mutations, these variants?
Yeah, so I think we have to be very careful with these because clearly we don't have all the answers. So it's a totally appropriate to proceed with caution to make sure that we get it right. And I think it's also appropriate to be very open-minded to new data that emerges so that you might see pivoting of public health policy to align with new data. So that's the first point. But while we don't have all the answers, it's totally appropriate to proceed with caution. The variant that was first discovered in the United Kingdom is clearly more transmissible. And we've seen an explosive outbreak in that nursing home in Barrie. We've seen an explosive outbreak in a factory yesterday in a plant in Toronto. We've got to be very, very careful with that. The variant that was first discovered in South Africa and also the one in Brazil are concerning because it appears that the vaccines, while still effective against those variants, appear to be less effective against them. Now, it's still important to note that the vaccines still work, the current vaccines still work, but they might not be as protective as with non-variant strains.
Right.
And on top of that, it's also important to recognize that even with those variants, the vaccines were still able to prevent severe illness. So no hospitalizations and no deaths. But of course, we would want them to be better. We would want them to prevent infection a little better as well.
So we're talking about how they could, at the rate at which they're reproducing, become the dominant strains in our country very quickly, February or on into March. Can you explain that? Is there any new data on that?
Yeah. And in particular, that's the big threat is the variant that was first discovered in the UK. That's the B117 variant. Because that is more transmissible and there's community transmission of this. Like there's outbreaks of this, it is circulating in the community. And this is the kind of thing where the more you look, the more you find. Because it is more transmissible, it will, for example, outcompete, let's just call it garden variety COVID-19. And we've seen this unfold. We've seen this play out in other countries. You're watching it happen in the UK. We're watching it happen in Denmark. We're watching it happen in Israel. I think the other thing to remember is, what do you do, right? So what do? You've got a more fit virus, a virus that is more easily transmissible. You double down on your efforts to control viral spread. You really have to be careful here. You've got to have safer indoor environments. You've got to have safer schools, safer workplaces. But those measures to control the virus still work. If you look at the curves in the United Kingdom, they went straight up in December, probably because of the variant, but also human behavior. But then they've come straight down as they've had community control efforts working there. So while it is concerning, while we have to take it seriously, while we have to proceed with caution, we can still get this under control. We just have to work harder to get it under control.
So you said a couple of things that I'd like to ask about. The rate of transmission, but also community spread. So on the transmission point, the Globe has a report now, which is actually quite frightening in terms of how transmissible. It talks about York Region, which is near Toronto, where some people have tested positive for the variant in a retail store for just a few minutes. And then there's also a reference in this Globe piece, Dr. Bogoch, where the Simcoe Muskoka District Health Unit, that's where the Roberta Place is located, has talked about shortening the exposure time to as little as a second when dealing with this confirmed variant if individuals were not wearing face masks. Is this what we're talking about? This is that transmissible?
I think the fair assessment here is we just don't know. I think it's fair to say it is more transmissible, but then why is it more transmissible and to what extent it's more transmissible? I would say that those are still questions that are being addressed. And there's different theories about how the variant binds to our respiratory tract and how the variant is transmitted and the amount of virus needed to cause infection. But quite frankly, I think that this is still being worked out.
Okay.
What do you do in the meantime? Number one, wear a mask indoors. Of course, we have to continue to wear masks indoors and wear the masks that the Public Health Agency of Canada suggests that we should be wearing. Number two, create safer indoor spaces with ventilation, physical distancing, and masking. Number three, carry on with our hand sanitation and really all the other efforts that we've been doing since March. This might change with time. Yeah, exactly. This might change with time. Like, we might have newer guidance, but for now, we know that this works. It's working in the UK. It's working in Denmark. It can work here.
Okay. Last question, although I think we're going to have to carry this on because I have a lot of questions about variants, and I think Canadians do. But here's something that struck me. A number of the cases in Canada, and actually elsewhere in the world too, but Canadian cases, you hear from public health officials, they do not appear to have a link to any travel. So how does that happen then if there's no travel link? I mean, is it something that they will eventually discover there is a travel link, or how does it just show up and have community spread if there is no travel link?
Yeah, that's because there's community transmission of the variants. This is the classic case of the horses out of the barn. It's here. It's been here probably for weeks or perhaps even longer, and it's transmitting within the community. This is the kind of thing where the more you look, the more you find. The Quarantine Act certainly shielded us from a lot of imported COVID-19. It wasn't perfect, but it did a very, very good job in shielding us from a lot of COVID-19. But of course, it's not. We're not living in a hermetically sealed bag. Like, cases got through, but it's still shielded. Now we've got those additional measures at the border, which will it'll add incremental levels of protection. Again, it's not perfect, but it just adds another level of protection to help stop the importation of variants. Having said that, travel is only about 2% of the cases we have in the country, and we still have to work very, very hard to keep our community levels low. Vaccinate, 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 and create safer indoor spaces for schools and places of work to keep those cases on the downtrend. And we'll be okay if we can do those three things.
We may hear about travel today or this week from the Prime Minister. Dr. Bogoch, to be continued. Lots of interesting information and important information to discuss on these variants. I thank you, as always, for the time this morning.
Have a great day.